Welcome to Research Detectives. In this episode, we're investigating why some types of pain relievers can lead to addiction and overdose, and meeting scientists who are doing something about it.
Pain is the number one reason many Americans go to the emergency room every year. And while there, they often get pain relief medication. Makes sense. Unfortunately, many of these medications have side effects that can be addictive.
Specifically, opioids. Powerful medicines that provide effective relief but also cause a range of side effects. You have undoubtedly already heard of opioids, not so much because of their pain-relieving properties, but because the opioid crisis has caused thousands of deaths due to addiction and overdose. People with stroke pain, cancer patients, car accident, and injury victims all urgently need safe and reliable pain relief. But the go-to pain relievers, opioids such as hydrocodone, oxycodone, or morphine, carry a risk of a range of side effects. They can slow breathing, slow digestion, cause overdoses, and more.
So today I want to talk about addiction now and healing from addiction, because I believe that it is our number one global crisis.
Donna Marks in Palm Beach County, Florida, has helped many patients deal with an opioid addiction. She is a psychoanalyst, psychotherapist, and licensed addictions counselor. During 30 years in practice, she's literally treated thousands of patients.
I can tell you many examples of people who had been sober even for years and years, and then they had to have a surgery, a knee operation or whatever. And what happened is the doctor said, here's your prescription. I know one person who was given 90 with a refill of 90. And they take it because they're told you must take this medication. It's very, very serious. So what happens, that drug hits the brain and then the person's like, is it time for my next pill yet? And they may have never had an addiction or they may be in recovery, but the consequences of these drugs are very powerful.
Can you help us understand why recovery is so difficult?
Recovery is a process. It takes a little time, and you need to be able to work through the emotional pain of it, the physical withdrawal of it. This is important to really keep this in mind whenever someone's going to have surgery or is in an accident or for whatever reason has to go on pain medication. It should be short-term and not long-term.
Pain is important. It's a critical messenger. Neurons send signals to the brain, alerting it that you've put your hand on something that's too hot. Maybe you stubbed your toe or you've broken a bone, and that something needs to be done about it. Opioids work by blunting those pain signals. They're powerful, and they're useful when living with overwhelming pain is just not an option. Pain is just one part of the body's complex communication system. Dr. Scott Hansen, associate professor in the Department of Molecular Medicine, explains why pain is so important.
And so the pain is a protective mechanism to try and preserve the structure of a cell. And so when it needs a threshold, it needs to know when it's reached a force that's just too much for the cell to handle and is going to damage the cell. And so we've evolved to have pain sensors or ways to sense the amount of force. And it's not an easy problem to solve. And then it also needs to move up and down. So after you hurt your arm, it gets sensitized, right? If you have a cut and it has inflammation, it's all red. I mean, you barely touch it, and it's painful. And that's because once you're injured, you need more protection. We want to control pain, really. That's the goal. We need to be able to control it. But we need to understand how the thresholds are set. We need to understand what the sensors are and where the pain comes from. It's a dynamic process. All this needs to be understood at a molecular level in order to treat it or to control it.
Pain is personal. Everyone experiences pain in their own way.
Pain is very different among different conditions, from surgical pain needs through chronic inflammatory pain to visceral pain, and then there's emotional components to pain as well.
Dr. Laura Bond, professor and chair of the Department of Molecular Medicine, has seen an evolution in people's awareness of the benefits and side effects of opioid medications.
Everybody years ago would ask me, opie what, or not know how to pronounce it, or what is that word? But now everyone knows what an opioid is because of the opioid epidemic.
How is it that opioids make someone not feel pain?
Essentially, you have a source of pain, so an injury or an incision or whatever, deteriorating hip, and you have a neuron that's firing and saying, ouch, and it's hitting your CNS, your brain, and saying, this hurts, this hurts, this hurts. The opioids hit on those neurons and neurons that feed into those neurons that say, stop firing. And so it just stop. And it's calming and soothing. And
So is part of your goal to help people alleviate pain without upping the dosage?
right? So these are the things we're thinking about. We're thinking about the problems that we face in society. We think about the problems of developing a substitution therapy, something, because I don't know that it's been very effective to just tell people to stop, right? What can we do to make the transition easier? What can we do for chronic pain treatment? These are the questions that we wonder if a molecule that has these different properties could be fine-tuned to open the avenues to these different therapeutics. Pain is a problem in every condition, right? It's pain that's in psychiatric, it's in injury, it's in inflammation and chronic illness and cancer, it's in all disease, and everyone will experience pain at some point in their life. So we're taking an approach where we're trying to develop new pain medications that have less side effects than the current ones. The problem is alleviating pain for the rest of your life if you have a chronic condition, or taking it for months if you have a chronic condition. And that's where it becomes more tricky, because with chronic treatment, you develop tolerance. And so tolerance means you have to start elevating your dose over time to get the same pain relief. Tolerance, dependence, constipation, respiratory suppression are all side effects, but they're all different. The goal is to learn from the past drugs that we use clinically to say, how can we make this safer, more tolerable, less tolerance, less highs and lows?
Dr. Bond is investigating a range of ways to get rid of side effects, including removing those side effects one by one, to see if the medication still relieves pain.
So you try different things and see which one causes what side effect at what level?
Since there are so many side effects associated with opiate analgesics, I think we have a good chance to eliminate or at least dampen several.
Can you help us understand the difference between being dependent on something and having side effects from it?
Well, you could call dependence a side effect. I mean, it's not the desired effect. So I would say that that's a subset. You may be willing to tolerate a little tolerance in order to alleviate the pain, but you may not be willing to tolerate nausea and vomiting to alleviate the pain, right? So depending on the use, I think we're going to have different types of compounds and drugs made.
Scientists now have a better understanding of the body's complicated system of delivering pain messages, and that is an important breakthrough. Advances in technology are accelerating the scientists' pace of discovery. Scientists like Dr. Bond use high-powered microscopes to actually see the structures of the molecules involved in sending pain signals. They can then use high-performance computer modeling to suggest compounds that might interact with those structures and change how pain signals are sent and experienced. They dial up the desired effects, like pain control, and dial down undesired effects, like slowed breathing, simply by making small changes to the chemistry of the compound. During the past decade, Dr. Bond and her team have developed hundreds of compounds, including a few that are promising. One in particular may provide long-term pain relief without some of the most dangerous side effects.
We call it SR1718, simple. This compound is a compound that we developed here at Scripps in Florida. Over the past 13 years, we've had funding from the National Institute on Drug Abuse to develop compounds that do exactly what I've been talking about. 1718 was a good example of this. We had pain relief, very similar to morphine, and no respiratory suppression. So this is an exciting proof of concept compound.
Scientists are also still learning a lot about another major side effect of opioids, drug craving. It keeps people addicted. Dr. Courtney Miller has developed a compound that could one day change the lives of those addicted to methamphetamine and a combination of meth and opioids. The compound is very targeted. It essentially rewires the brain and eliminates cravings for those two drugs. And it does that by restoring the neural pathways to the same state as they were before either of those drugs or a combination of the two were ever taken.
Can you talk to us about substance use disorder?
Substance use disorders are a really big challenge. They are very much not a matter of low willpower, because drugs change your brain so that you lose control over your decision making. And so that means that you can come across something that makes you want the drug really badly. So we're really trying to address a specific problem in substance use disorder, which is there are a lot of opportunities to establish abstinence, right? Recovery programs that can help people manage withdrawal and things like that. But then you go back to your real world life and you're surrounded by reminders of the drug use. The environment, the neighborhood, maybe who you were buying from, and those can all really induce a strong sense of craving and motivation to start using again. And it's because drugs can literally change your brain, the way that it's wired and functions. And so we've been looking for ways to kind of press a reset button to try and return the brain to before drug use, to try and give people a fighting chance, right, to be in control over their decision making when they're, abstinent, because these reminders can induce craving, decades into abstinence. So it's really a lifelong problem. And so what we found is a way to set the reset button on cravings for methamphetamine specifically, and with a single administration of a medication we're developing.
When someone consumes an illicit drug like methamphetamine, it causes a huge change in the number of neuronal connections in really specific parts of the brain. And then that ends up driving the craving that someone can experience later when they encounter reminders.
Got it.
And so it's really taken over the brain's control of motivation.
We can take away that craving during that reminder, then hopefully that person can not use it anymore if they don't want to.
Is to really give them control again over their decision making.
So you're sort of breaking that craving cycle and people just don't want the drug anymore?
That will be exactly what we'll test when we get to clinical trials, but our preclinical models suggest exactly that. It's really unexpected and it seems to be very long lasting, but what's really important too is that it's extremely selective. So there's something about methamphetamine that has this effect on myosin where it stays active, but for other things it doesn't. So it's important because it means that, in treating individuals with methamphetamine use disorder, you wouldn't have to worry about having these sort of blanket effects on their memories and motivations. There's a whole circuitry in the brain that's responsible for craving, but a really central player is the amygdala, which is the emotional memory center of the brain. And what we found is that methamphetamine really has a unique effect on the proteins there that are controlling the information storage that drives that motivation. And so people don't actually even have the opportunity to engage that decision making, to say, is this in my best interest or not? So it's really specific for methamphetamine use disorder, although we're figuring out ways to apply it to, for instance, cocaine use disorder.
Scientists don't actually know why some people never become addicted to pain medication and other people do. That's a significant focus for researchers, but they do know everyone responds differently to pain and pain medications.
As a scientist, we understand that. We know that pain is actually different for everybody. And so if you're really feeling that pain, it's real to you. That's your reality. And so what needs to happen is we need to understand how that's set. And we need to, and this comes back to understanding the fundamental basis of the sensors and what's going on, because we need to fix that. And we actually need to change how somebody feels pain. And pain is a sensation that's in your head, basically. It really is. It is, biology has evolved this idea of pain in your head, and it's very beneficial to us. But since pain is a response to mechanical force, it's really whatever your body sets it at. And this is really unfortunate because there's people who their body sets it at the wrong level, and they literally do experience the pain. It's as if, you know, we've all walked by a table and like hit our toe, and it's just excruciating. And you know, some people say things they shouldn't, right? Like it just, like it's excruciating. Well, guess what? Some people feel that all the time, and their brain is setting it that way.
Dr. Kirill Marchenimov is chair and professor of the neuroscience department. He describes pain as a wake-up call.
It's almost like, you know, an alarm clock, which is extremely loud in the morning. But the way we register it is through this neuronal communication. As one cell out there in the periphery detects the invaders or something that's wrong, and it sends it through the chain of command until it gets to the brain.
He's working to better understand a different part of pain, the brain's complicated system of receiving and interpreting pain signals. The body has proteins that act as in-house receptors, receiving pain signals. Understanding how the opioid receptor identify and deal with pain is a key part of Dr. Marchenimov's work.
My lab is a basic academic pursuit of trying to understand how the signaling process works in the nervous system.
Seems like a big area of study.
Yeah, it is fairly big, but when you think about the brain, it's a complex computer, right? There's lots of neurons, those have brain cells, and all communicate with each other, and we're trying to understand what's the language that they use for the communicating and deciphering those messages. So that's what we do. What my lab does is basically trying to understand what are all those elements in this opioid receptor detection system that allows it to interpret the signals. So there's lots of neurons, those have brain cells, and all communicate with each other.
So how does that come back to pain?
When you get painful stimulus or the visual stimulus or any type of the stimulus in your surrounding area, that typically means that the signal has been sent, that it needs to be received and transmitted. So pain is essentially this emotional experience that we have, and it's also a sensory modality that we register that something went off, and that you need to really, really pay attention to. And that's why it's so unpleasant, and it registers as very unpleasant.
Dr. Marchenimov and his team have made several advances, including the discovery of a key gene with Dr. Brock Grill that could make a huge difference. The gene provides insight on how, over time, people develop tolerance. Tolerance increases the risk of both drug addiction and overdose.
The finding could drive discovery of a new generation of medications with a lower risk of overdose and help with innovation, not just for pain medications, but other drugs as well.
So the gene that you've mentioned, we've discovered one of the more recently discovered genes, is called PATCH-T1, and that is a powerful regulator of the opioid signaling.
If scientists can figure out how to manipulate this single gene, it could potentially open the door to discovering a new drug that would not require an increase in dose to remain effective.
Not only is it going to be clinically important to block this pathway so that the opioids remain efficacious over a longer period of time, and especially when you're dealing with the chronic pain issues, but also possibly helping people with a substance abuse that, you know, prevent the death from overdose.
The finding could help us develop a whole new generation of drugs with a lower risk of overdose and help with innovation not just in pain medications, but other medications as well.
Solving the pain problem requires a lot of investigation from many different angles. Dr. Hansen has discovered a link between pain and cholesterol and learned it could play an important role in the development of new pain medications. Cholesterol is one of several fatty molecules known as lipids. Just so you know, the link between cholesterol and pain has nothing to do with cardiovascular disease.
We are an a group that is at the forefront of trying to understand how lipids are involved in pain. And we've known for a long time that they've had a role, but they've been difficult to understand. We basically think of lipids as an early form of structure. And one lipid in particular is cholesterol. One of the main things cholesterol does is it solidifies lipids, or it forms these structures or hard regions of the membrane. We need to understand what the sensors are and where the pain comes from. And so that's why this research on lipids is really important. Lipids are complicated. There's lots of them. They're really difficult to work with. I mean, if just working in your house, if you get grease all over your hands, it's just annoying, right? Well, guess what? In the laboratory, that grease is just as annoying to us too. And so, we didn't really set out to think about biology this way, but, it's important. And we saw no other way. We went studying it thinking it was going to turn out a different way, and then it didn't. And then we're like, well, wait a minute, maybe it's these lipids that's doing this. And really it was the science that forced us to think about it. And I joke about this to my lab sometimes. It's like, oh man, we become this lipid lab that I wasn't at all the goal of my lab. But at the end of the day, scientists want to answer the questions.
I think that's what makes science fun, is the journey. And there's always sort of unexpected twists and turns. And a lot of times it's, I would say, through the nature of the people that you work with and encounter. And so it was actually in collaborating with my husband's lab, and where he was looking at this myosin, and he's the one that found that it acts directly on actin. And so after that work, I picked it up in my research group and started asking the question of how does that apply to substance use disorders. And so really early on, we made this unexpected discovery that myosin is behaving in a really unique way with methamphetamine.
Research detectives are working diligently to discover new pain-relieving medications with fewer side effects, but it takes time and money. Once scientists identify a potential compound, then they start looking for ways to improve it. But that's just the beginning. Dr. Bond and her team are also trying to find pain-relieving compounds that may alleviate the anxiety that some patients experience. They worry that as the medication starts to wear off, their pain will come back.
A big part of pain is the anticipation of pain, right? If you've ever been on meds and your drug starts to wear off and you start to think, oh, I'm really going to hurt. And so I think that emotional component of pain would be very useful to address, a compound that may actually alleviate some of that anxiety.
And they're trying to find medicines for specific types of pain.
As far as the types of medications, I think can be as diverse as the types of pain.
Her work includes research to discover new treatments to reverse the effect of opioids by using the drug naloxone, also known by its over-the-counter name Narcan. Narcan is a vitally important rescue medicine used by first responders to rapidly reverse an opioid overdose. Dr. Bond is working to develop a version of Narcan that's longer lasting, more powerful, and more effective against some of the stronger narcotics that we're seeing now.
Instead of trying to just develop pain medications, we're trying to develop better Narcan. Something that lasts longer, that outcompetes fentanyls and carfentanyls and these crazy analogs that are coming into the country. So that's a first line of fight it with other chemistry or better chemistry.
At this point, we do need to take multiple avenues and develop compounds that could work in those different avenues. Opioids are very good compounds. It's not curing pain that's a problem. It's getting that cure without the side effects. And so I do think that it's possible. I know it's possible, and that with the proper understanding, we will develop those molecules. There will be better pain management in the future. I'm certain of it.
In the meantime, if your doctor does prescribe opioids for severe pain, the CDC recommends you work with your doctor to create a pain management plan, including things like taking the lowest possible dose for the shortest possible time, asking if other medicines are options, and making sure that you don't take opioids prescribed for someone else or share or sell prescription opioids that are prescribed for you. Finally, avoid alcohol. Don't combine opioids with other drugs that make you sleepy, and make sure that you store any opioids in a secure place away from children. And of course, that first one again, take the lowest possible dose for the shortest possible time. We all play a role in managing our pain, so it's important to educate yourself before you take any kind of medication.
People need to understand it's not their fault if they got addicted. It may feel like your fault because you're sitting there wanting more and more and more of it and you get stuck in that pattern, but it's nobody's fault if they become addicted. Let's get informed before we put those pills in our mouth. Your brain and your heart and your lungs and your kidneys and your blood, these are very vital and important parts of your body, and we can't just take it for granted that these organs are going to tolerate anything that we do to them.
Drug development is a process, and understanding the biology of pain is complicated, but there's good reason to be both inspired and encouraged. Thanks for watching this edition of Research Detectives. I'm Trace Dominguez. See you next time.